Don't study law, Jefferson. Study men.
I do remember the last time I saw her. She was standing on an auction block.
We intend for independence.
He tells me that he wants liberty and equality.
But fear within a city.
A free white English woman.
Of course, Lord Cornwallis himself.
Friends, you have been a delight. It is always a pleasure.
The dignity.
Good afternoon and welcome to Colonial Williamsburg's Trades Tuesday live stream. Today we're on the topic of fashion and health medicine. My name is Janae Whitaker and I have the honor of being the milliner mantua-maker here at Colonial Williamsburg. So my specialty is the fashion, and I have the pleasure of spending the afternoon with my sister.
Thank you, Janae. My name is Robin Kipps, and I'm the supervisor of the Pasteur and Galt Apothecary. My background is medical history, and we're filming here in our shop today. So you can see behind us is our great collection of antique drug jars and bottles. Normally when one thinks about 18th century medicine, one might think about coming into an apothecary and being prescribed by the person behind the counter and picking up a medicine. A topic that you don't see published much in modern professional literature today is the whole topic of regimen. And that was something that doctors also prescribed. So think of it as your to-do list. It's the foods you should or shouldn't eat and the activities that you should pursue, which means special clothing. And whenever we've needed anything, you as the milliners have always helped us out.
It's always been fun.
It's been fun, right? So one of the things that as 18th century doctors were diagnosing is jaundice. And the medical textbooks recommend horseback riding every fair day, translates sunny day. And from a modern standpoint, we know that sunlight does help jaundice. So what would you recommend?
A riding habit for the ladies. And joining us now is Rachel, who is our intern from William & Mary this semester, specializing in public history. And she's wearing a riding habit that is, for more exercise, is more loosely fit, based loosely on a gentleman's suit, but could be made by the mantua-maker, the dressmaker, or the tailor. So I think that would be very pretty side saddle
That
on
would
a
be
horse.
gorgeous.
Yeah.
And we have a special person to thank for this?
Huh? Oh, the professor. I'm sorry. Yes. And her professor gave special permission today so that she could skip class to participate in this program with us today. Thank you, Rachel.
Thank you, Rachel.
And your professor.
Yes. So another item that we diagnose 18th century is consumption. Some of that today would be diagnosed as tuberculosis. And one of the recommendations for patients dealing with that condition is a long sea voyage to a warm climate.
Ooh.
And that reminds me of Caribbean cruising, yes?
Yeah. I wonder if we could get a doctor today.
I
to
wonder.
prescribe that.
RX cruise.
Yeah.
That'd be great. So, of course, today for cruising, there is specialized clothing. What about in the 18th century?
Yeah, there's actually a whole sort of category of clothes that are called traveling clothing. And they would be very nice aboard ship, 18th century, or, traveling in a carriage.
And in that carriage, maybe you don't go on a cruise, but there's also travel destinations that are recommended. And one of them was a warm spring. So if you had a patient that was trying to recover from aches and pains, such as Dr. Galt, who was in here, that went to a warm springs late 18th century. Or we know that Mr. and Mrs. Washington and Patsy went to a warm spring to trying to help Patsy with her health problems. So what would you recommend for Mrs. Washington and Patsy?
Oh, well, there's various styles of bathing gowns. Not what you think of, modern, but a nice loose shift-like garment that goes down to about the ankles. And one of the interesting aspects of it is the little pocket here at the hem that we suspect is for a weight so that the linen doesn't float when you submerge yourself in this nice warm environment.
Excellent. And the documentation for this is?
It's based on an original. So, you know, somebody may have been able to wear the original many, many years ago.
So segueing into bathing, I know you've run across definitions between bathing and washing.
That's right. I mean, no, people didn't bathe very often because they didn't go to the ocean to take the waters or, you know, a hot spring very often. But washing appears to have been performed daily. You know, it might be a basin with a little bit of soap and a little bit of water and a rag. Washing as much of the body as is personal choice, but keeping clean is important, 18th century.
So keeping the body clean, but also keeping your clothing clean was another topic. And what do milliners recommend about clean clothes?
Oh, totally. I mean, clothes are an investment, and so you want to protect that investment for as long as possible. And keeping them washed is very important. On our property, the Margaret Hunter shop, we know that by 1787, Margaret Hunter identified at least 2 enslaved women who had those skills. Fine laundry, was clear starching, washing and ironing, and as a nice side skill, they were also good pastry cooks.
I'd want to come visit your millinery if you're serving pastry.
Of course,
right? Yes.
Yeah.
Well, and doctors also had recommendations about clean clothing. And I think there's an interesting reference in Dr. George Motherby's medical dictionary. And under the definition of contagion, he talks about 3 ways that disease is transmitted. And one of the ways is listed officially as infected clothes. And normally you see doctors concerned about clothing and contagion when they're dealing with large populations like prisons, onboard ship, hospitals. And they're usually talking about scabies or smallpox or jail fever, hospital fever, some of that which would have been typhus. And of course, 18th century, they don't understand the microorganisms causing those conditions. But today we know that yes, clothing can be a way to transmit disease. One of the other things that we see doctors talking about is on a day-to-day basis, clean clothes. So Dr. William Buckins says that yes, you as a mother may not be able to dress your children in fine clothes, but there is no excuse for letting that child be dirty.
Dirty,
Would you agree with that?
I totally agree with that. And also, it's very interesting that we had a discussion at lunch one day about vermin, like lice, body lice, being attracted to the open seams of clothing. And so we made the sort of the connection that shirts and shifts, that first layer of clothing that people wore, the seams are closed. They're very well stitched. So we don't think that those little critters can get into the seams.
So the opinion is those seams could be closed because you're trying to keep the edges from raveling, but also because as an 18th century person, you don't want to get bit.
Right.
An average stitches per inch in a shift or gown?
Depends on the fabric. The finer the linen, the finer the thread, the finer the needle. Maybe 20 stitches to the inch is pretty normal, but I have seen an original 18th century shirt that was stitched with 45 back stitches to the inch.
Wow.
So that means maybe coming to the doctor for some strained eyes might be...
We're going to see John Greenhow up the street, which sells glasses
Right.
for Eyesight.
Yes.
All right. Excellent. So at this point, I think we should take a break, don't you think, and see if there's a question that somebody would like to ask.
Thank you so much, Janae and Robin. This is producer Brody Adams here. I'll be giving voice to some of your questions today. So we have a question about something you mentioned earlier regarding the various methods of getting sick in the 18th century. You mentioned one of them, which was the infected clothing. But I believe you said that there were 3 methods. What are the other 2?
The other one is the sense of touch. And today we know that smallpox, which thank goodness has been eradicated, it is a live virus, and touching a person, touching the source is a way to transmit that. But it's also airborne. 18th century we didn't understand viruses, but the interesting thing is through observation, realized that the air in certain areas like hospitals, people tend to get sick more often than if they're at home. So 18th century, they talk about sick patients, their bodies give off particles or effluvia, which is in the air, and you have contagious particles in the air. So there's 3 different options, but germs isn't one of them.
Not yet.
So, and I think our next piece, we wanted to talk a little bit about protective clothing. And you brought some interesting pieces.
This is actually one of my favorite pieces of 18th century millinery, and it is a child's pudding cap. Basically, you're talking about seeing a padded crash helmet for little ones who are learning to walk. I think the 18th century realized that floors and furniture are not especially baby friendly. So a little protective headgear for boys and girls. To go along with that, then a pair of stays might be also given to that young person who is on the verge of walking. This is made of cardboard, pasteboard, and is designed to remind little boys and little girls to stand up straight, good posture, so that you learn good posture in the walking stages, instead of, trying to remind folks as they're older to stand up straight. They are laced loosely, as is proper. Yes, there were people who tight-laced or straight-laced, but that was the extreme of fashion and not to be recommended.
And as doctors, we would agree with you that patients should not tightly lace their stays, as well as pregnant patients. Doctors are pretty emphatic about pregnant women not tightly lacing their stays. So I'm glad we agree on that issue.
Yes.
Have you found an interesting reference that a doctor made about?
Oh, yeah, it was when we went to the National Library of Medicine a number of years ago, and I found a late 18th century, early 19th century medical book. The doctor was talking and reminiscing about 30 years earlier, so our time period in the 1770s, and he said tight lacing then was done by women of uncertain age who were trying to recapture their girlish figures.
Interesting motivation.
Yeah.
And today we know that those stays do not actually give you a tinier waist. They
No.
kind of add a little bit.
They do, they do, yeah. So that's taken into account when we're making a gown for someone.
All right.
Yeah.
So our next ensemble, using the lacing as a guide there for the baby stays, we have an item of clothing worn by mental patients. So this is a straight waistcoat based on a written description, 1772, by David McBride. And it is being modeled by Margaret, who is recently graduated from William & Mary, who's working with us now. She's being tied in by Sharon Cotner, my dear colleague of over 40 years. And her specialty is reading the awful handwriting in the late 18th century account books and translating the Latin. So tell us about the...
Well, this was a really fun project because you brought us the reference to this straight waistcoat, and since it's a waistcoat, we thought it should be short. It says that it's laced up like a pair of stays. Most stays lace in the back, so we put the lacing in the back. But what I thought was the most intriguing was that the sleeves are so long that they cover the fingers and are drawn up like a purse. So a drawstring, and then in order to bring the arms close to the body, those long strings are tied behind.
Doesn't look very comfortable.
But
one thing McBride mentions is that if you're taking care of mental patients, there's a lot of time devoted to making sure these patients do not hurt themselves or others, and that this device was considered one of the best ways of restraining a patient without hurting them. So seal of approval by 18th century doctors. Thank you, ladies. So today, when one thinks about protective clothing for surgeons, one might envision seeing a professional being covered head to toe in disposable clothing. And obviously, we're not doing disposable clothing 18th century, but there is a little bit of documentation and period prints for surgeons. And today we have Mark, who is a graduate of William & Mary from the law school, America's first law school. And he is modeling a reproduction set of surgeons' sleeves and apron.
Surgeon's aprons to protect the clothing during the practice of his profession. And what I find intriguing is the short sleeves tied above the elbow. Actually, you see in, quote, civilian wear, where people perhaps didn't want to buy the whole shirt that was very, very expensive and fine fabric. So there's just the evidence of it, you know, on the sleeves that somebody actually might see. So it was professional wear as well as civilian wear, 18th century.
Documentation for this comes from William Hogarth's early 1950s, 1750s print of a surgical procedure being done at Surgeons' Hall in London, as well as Thomas Rowlandson's scene from the 1780s of a doctor selling medicines. And incidentally, in the print, it shows blue sleeves.
Yeah.
So, thank you, Mark. Appreciate it. Yeah.
Now, I brought a piece that I'm rather intrigued by. This, of course, is a calash bonnet, and we start seeing this style, you know, designed after a carriage, convertible. But we see it in the 1760s, but in 1777, we see a beautiful fashion print where the lady has one of these attached to the back of her jacket in the winter time, so that they say she can protect her neck from catching cold. And when it's not worn, it's kind of hanging straight back. Maybe as a rain catcher, who knows?
And we would agree with you. As doctors, 18th century, staying warm was considered conducive to staying healthy in the wintertime. Of an anodyne necklace, which is basically beads which would be tied on with a ribbon. And it's designed to take care of aches and pains. Target audience would be teething children who are fussy and aching, as well as pregnant women about ready to deliver, and anybody with affections of the head or afflictions of the head, such as toothaches or headaches. And this is how they market it. This is how they explain it. So camphor, this lovely item, which is in modern deep heating rubs and used for chest colds, is described in the advertisement for anodyne necklaces as producing an invisible particle sensible to the nostrils.
Smells good.
Would you agree?
Yeah.
All right. So therefore, it's believed that this gives off atoms, and that's the word they use, atoms or particles. And then taking that one step further, they believe these necklaces give off particles, and that the longer you wear it, the warmth from your skin makes it throw off more particles, and those particles are absorbed by part of the body that's aching. So this is their rationale of why you should buy. Problems that we're trying to solve in healthcare is the issue of men doing deliveries, taking care of complications, and needing the assistance of surgical tools, specifically forceps. And patients did not like to hear about them or see them, but doctors felt they needed to be used. And so William Smellie, in his 1762 reference, mentions using a loose washing gown. So we would like to show you this loose washing gown. And this is being modeled by Hank Kozak, who is a pharmacist, actually, graduated from the College of Pharmacy in Philadelphia, our first American pharmacy school. And the solution, those great pockets. And inside each pocket is
1/2.
1/2 of obstetric forceps.
Yeah.
Yes.
So when you brought us this reference of a washing gown, our immediate thought was to make what's called a wrapping gown, which is very popular with 18th century men to wear at leisure, and here in Virginia in the summertime, our men might leave off their suit coat to wear them. So seeing it in a more professional setting was kind of intriguing. Making the pockets big enough for the equipment or the tools was a little bit of a challenge, but a lot of fun.
I think you guys did a great job. Thank you. Yes. Thank you, Hank.
Yeah.
We appreciate it, yeah. So our last question here, what do we do with all these linen clothes when they're worn out?
Well, the scrap basket in our shop would be saved for the paper maker, to be sure. Today, 21st century, our fellow trades come and get the scraps for polishing and other, needed things in their trades. But I know there's some other 18th century uses for old linens.
Well, we found a great reference in a 1777 edition of the Virginia Gazette, our local newspaper. So we have several military hospitals here in the area during the American Revolution. And the doctors are begging people to please donate their old linen so they can make bandages. So this one is called the mask. It's from Heister's text, 1747. And if you can imagine a patient with a gunpowder burn to the face, this is what they look like while they're recuperating. And to keep the linen from adhering to the skin, that same camphor we were talking about earlier is made into camphorated oil and applied to the skin. So,
Do you think Mom and Dad recognize me?
I don't think so.
I don't think so.
So, and at this point, I think we would like to hear from our audience, to hear if you have any questions that you would like to ask.
Hello again. Thank you all so much. This has been very interesting so far. We do have a few questions coming in from our audience. One from Ellie would like to know, is this a new shop or how long has the Apothecary been open?
We have a new paint job, which was done during the pandemic, so it may look new as far as the color, but we actually opened 1950 October during National Pharmacy Week. So we've been here for a little while. Yeah. Thanks for asking.
All right, great. Another question from Heather would like to know about the one of the drawers behind you. It looks like it's marked cream of tartar.
It is. It's the exact same cream of tartar that you use in your kitchen today if you were designing to make snickerdoodle cookies.
Ooh, yum.
And 18th century, there is a tooth powder that is actually made with cream of tartar, cinnamon, and a plant product called dragon's blood. Also used 18th century as a downward purge. Not to be tried at home, but it was used as a laxative as well. So yes, and these are all in our favorite language, Latin.
And these are the ones that are from the 18th century medical records for this shop.
These are site-specific, yes.
Wow.
Yeah.
All right, great. We have another question here from Tina who would like to know, did doctors recommend any particular styles of clothing for maternity wear? Or what about the stays? Was there a different way they were supposed to wear those when they were pregnant?
Well, definitely loosely laced.
Loosely laced. Go for it.
is definitely the order of the day. There is a style of stays that laced on the sides as well as merely the front and or the back, so it could adjust with the increase. But there's not a whole lot of separate maternity wear because the clothing that we wear generally in the 1700s is made to adjust, and it can be worn the entire way through pregnancy. Yeah. So the maternity wear industry hasn't developed yet.
Right. And the only other thing I've ever seen is Henry Bracken mentions in the first half of the 18th century that pregnant women should not be wearing high-heeled shoes. Probably because it's throwing you off your balance at this point. Yeah. But I agree with Janae. It's wearing pretty much what you normally wear.
Because it's not a permanent condition.
All right, well, moving on from what pregnant women would have worn onto how infants might have been swaddled. In the 18th century, were they tightly swaddling infants, or was that a practice from an earlier time? Or
do you know, I used to know the date in England when they stopped swaddling, but I can't remember what it is. But by our time period in the 18th century, it's largely discontinued because you want to be able to, make sure the blood is flowing. So you rub
Needs
the
to
baby's
circulate.
legs and things like that. But infants are dressed totally alike. Babies are dressed totally alike. And children, a boy or a girl designated as a child is pretty much dressed alike until about the age of 4 or 5.
Right. And the other thing to add to that is William Buchan, again, in his 1770s text, written as a home medical guide, relates cases where he had seen children that were too tightly swaddled and they had convulsions. But once those the swaddling bands were removed, the convulsions stopped. So doctors, as well as other doctors, including him, were recommending tight swaddling was not good.
Yeah.
And he, from his personal point of view, the only thing children need is just something very light, simple, and loose, like a shift. So, good question.
All right.
Yeah.
And were there any elements of fashion that would undermine health or have a negative impact on somebody's health from the 18th century?
So, one of the beliefs, 18th century, about catching cold obviously is not due to a virus.
Right.
But they talk about people, if they're inside a warm building in the wintertime and they're dressed too warm, they have a tendency to perspire. And then when they suddenly go outside and they get cold, they suddenly quit perspiring. And so the official reason, and it doesn't sound very elegant, but the official reason for catching cold is obstructed perspiration. So doctors say don't overdress and get too warm at the time. And if you're thinking about stays, yes, there's some skeletons that have survived in other museums where the body was actually formed due to the tight lacing, and you think, oh, the poor person. But as we mentioned earlier, that's not recommended.
No.
All right. We have a question about what our surgeon model was wearing earlier. Were the garments solely for protecting the surgeon's clothing, or were they also maybe for some sanitary reasons to protect the patient from, stuff that may have been on the surgeon's clothing?
What we've seen as far as reference so far is it's pretty much to protect the surgeon's clothes because, cut down on the laundry that the people have to do after the surgeon has done surgery. But we've been studying this for many years, and we've never seen anything so far in the 18th century text that the doctors have started to be concerned about the clothing that they're wearing during surgery can cause disease. Now, there are 18th century references about if you're treating a person with smallpox, the smallpox contagion is on your clothing, and that you should wash your clothes before you go into polite company.
And isn't there a style of coat that some doctors are encouraged to wear that actually is waxed so that it can be washed or
That's right.
rinsed very easily?
Waxed linen fabric for
Yeah.
surgeons on board ship or in the British military texts after the war, so that the surgeons do not pick up the contagion, and that's easier to clean. Yeah, I like that question.
Yeah.
Another question we have here, and this is actually great for both of you. Would apothecaries have custom ordered items from the milliner, or was that more up to the patient or the customer?
Would the apothecaries custom order things from the milliner? Well, we sold some of the same ingredients.
Right, we're competitors.
Sundries, right.
Yeah.
So you all advertise
We have tea
toothbrushes.
and tooth powders, and we sold tea and snuff. Let's see, is there anything else? I think
Candles.
candles possibly, yeah, soap, definitely.
Soap, we sold soap.
Yeah.
Yeah, so in the sundry department, if we're not here out on an emergency, we'd say go to the millinery. When it comes to the items in the drawers, years ago they actually found the documentation for the source for these supplies, and it was a drug company in London called Wellings and Slater. And the ingredients are actually sourced internationally to Britain, to Virginia. So for what we're compounding with, that would be sourced
Right.
internationally. But when it comes to sundries,
Sundries or the clothing, I'm sure you could come to us. Because while we sold things ready-made, millinery like a shirt or an apron or a kerchief or cap could be sold ready-made. The 18th century customer likes to have the fabric laid out in front of them and say, I want this, this, and this made up into that. And oh, by the way, can you have it done for me by tomorrow? So we certainly would have wanted to pay off our account at the apothecary by the apothecaries owing us for things.
I hear you.
All right. Question from Susie. In the 18th century, were there dentists separate from, doctors and things like that? Or who took care of sort of those dentistry needs?
So dentistry technically is still a subspecialty of surgery. So when you're studying surgery 18th century through apprenticeship, or like the case of these two doctors that studied at a hospital in London, you're going to be getting background in surgery. However, there's a few people that are advertising as surgeon dentists, and one of them's here in Williamsburg. His name is Baker, and he is actually advertising in the Virginia Gazette that he will do fillings as well as make and fix dentures, and he's in and out of town. In fact, he does work on George Washington's, one of his sets of dentures, but that's, for the most part, that's the exception at this point.
So what they use for fillings?
Lead, gold.
Ooh.
Lead's easy to work with,
Yeah.
right? Molds nicely.
Mm-hmm, okay.
We prescribe it on occasion.
Can I afford gold?
Put it on your account.
Okay.
Well, that actually brings us to another question we have about the affordability of some of these things. Could somebody have a payment plan or something like that if they couldn't necessarily afford an item that was prescribed?
Well, we'll be glad to give a discount on the price if someone can pay with ready money or cash in hand. In our shop, we're known to have offered a discount on the price. It's even at a year, and interest on your credit account is only added after the first year at a simple 5%. So while we may not, give a payment plan, we will negotiate for payment. So if I need, some medical help, I might be able to work it off by, selling or making something for the apothecary.
That would be excellent. Yeah, and as I mentioned earlier, Sharon's been working on the site records, and a lot of credit is extended. In a lot of cases, no interest for some periods of time. And we do have cases where people can't afford medical care, and we do see the church. When you come to Williamsburg, Bruton Parish Church is several blocks up the street, and we do see them helping out with medical bills on occasion for people that need help.
In the 18th century.
In the 18th century, yes.
Yeah.
All right. So here's another question from Deb asking about sort of something that we deal with in the modern age. You go to a drugstore and you have over-the-counter medicines, but there are also prescription drugs. Was it sort of the same way with the apothecary in the 18th century? Could you just go to the apothecary and ask for anything, or did you have to have a prescription from your doctor for some items?
Okay, so two things. One is the word prescription is in use, and it refers to a recipe. So if you go to a physician, he can take his quill, dip in some ink, and write in Latin, RX, write the formula called the prescription, come in here and we can give it to you. But legally, none of these are government regulated till the 20th century, so you do not have to have a prescription.
Isn't there something that is regulated? Like live smallpox?
So no, that would be a treatment that would be regulated.
Okay.
That's a good question. Yeah. Yes. When we inoculate for smallpox, we are using, as you would call, live virus. So we would call it pus from sores, and we do know we can start an epidemic doing that. So Williamsburg does have some regulations about not doing it for a while.
Okay.
But as far as the drugs, our big issue is the status of the patient. Are they a free adult or enslaved? So an enslaved person, they are on the records for our site, but the choosing of what they get as far as a drug is pretty much open to their owner and the doctor.
Okay. So here's a question about people in the trades. Oftentimes they're, doing a lot of repetitive motion, thinking about blacksmiths or carpenters. Was there anything that they could wear or anything that could be prescribed as a regimen for those tradespeople to try and prevent repetitive motion injuries?
Have not seen anything yet. There is a really interesting book published by Bernardino Ramazzini. He's Italian, early 1700s, and he's one of the first to look at your work environment and how it impacts on your health. And you start seeing more books published mid-1700s, and other doctors are picking up on it. And basically, they haven't seen repetitive motion issues. We've seen a lot about sedentary issues, about the tailors that sit cross-legged on a table and their problems, or children working in factories and getting rickets, which today we know is the fact that they're inside not getting the vitamin D from the sun at that time. So they are making those connections. We do see things back to the camphor again. Ointments and camphorated oil used topically for achy muscles, but the problem is it's a little expensive. It's coming in from Japan and India, so it's a little pricey, but still used today.
All right. And what kind of things might be prescribed for vision issues or issues with the eyes?
There are collyriums or eye washes. So one of the things we use for irritated eyes, we call it white vitriol. Today you would call it zinc sulfate, and it is used in some over-the-counter products. Of course, we're in here comparing. We say talk to your pharmacist about actually using any of these things. When it comes to eyeglasses, Williamsburg, we are selling eyeglasses, but we're not really custom grinding lenses. But right next door to the Apothecary Society, downtown London, still today, is the Guild of Spectacle Makers. In 18th century, you could actually have custom lenses ground for your eyes. And if you have the fortitude to have your cataracts taken out, yes, there is, there's directions to have it done. The pictures are kind of hard to look at.
I can only imagine. We have a question from Matt, who would like to know, would the enslaved people go to the medical provider themselves, or would their enslaver accompany them? And did the doctor need the enslaver's permission to treat an enslaved person?
So a couple issues. When Sharon's been going through the account, she does see some cases where enslaved people come to the shop to buy items, but what's listed is something that could be used as a medicine or a sundry. I think cochineal is one of the items listed, and it's not really a drug in itself. It's listed more as a coloring agent. So yes, there's some of them that come in and can buy things. When it comes to needing medical care, they do have a little bit of money, but generally, I think if I was enslaved, I'd want my owner to pay for it instead of me having to pay for it at this point. But they are getting some care at the time. The other interesting thing is there's archaeological evidence of West African medical treatment being conducted on the plantation. So there's some things, ideas about cause for disease and illness that these people are bringing with them and still practicing here, which I think is pretty interesting.
Here's a follow-up question to that. Do you know of any of those ideas of medicine being integrated into the ideas that came over from Europe?
I'm sorry, the enslaved people?
Yes, the Western African practices and the European practices. Was there any melding of the two?
There are some cases. So Cotton Mather, who's in Boston and is the big proponent of doing smallpox inoculation for the first time in the colonies. One of the sources for him learning about the procedure of using pus from one person's sore, giving you a scratch and trying to give you a case of smallpox and then recovering from it, is from an enslaved person called Onesimus who came from West Africa. So that was one source of information. There were also people traveling in Turkey and China that were writing back to London talking about the same idea. There is one enslaved person here in Virginia that trades his secret remedy for his freedom, which I think is pretty ingenious. And then we also see a couple cases of Native Americans where some of their medicines get incorporated into the professional pharmacy books as well. So I mean, there's this big interest, 18th century, as to internationally, whoever you are, what can we learn from you in some cases.
Very cool. All right, just a couple more questions here. Did either of your shops sell any cosmetics?
Sell cosmetics?
Yes.
We sold ingredients if you want to make your own cosmetics.
Yeah, and there are books published in the 18th century that give you directions about how to make, lip salves and, blushes. And then cochineal, of course, the bug from Central America and Mexico that is very popular for that nice little blush
Right.
Yeah.
And 18th century, we would have had real spermaceti in the drawer, which is the oil from the head cavity of sperm whales. And that was used as a moisturizing product to put on your skin to soften the skin at the time. But you have to remember that right now we're not really into mascara, eyeliner, eyeshadow. We're interested more in cleaning the face and in blush and lipstick.
Yeah.
So that's, cosmetic industry has yet to come into its own.
All right. Well, one final question for you. What are some future projects that you're working on right now?
Well, the one I really want to tackle is the cork jacket, again found, and a description and a picture of it from one of your medical books, that is supposed to keep you from drowning aboard ship, or if you're, can't swim as you cross a river. So.
And then one of the other ones we found interesting in a 1740s textbook talks about a linen statue, where it's basically described as like a linen man, as we call them. And so if you were learning how to apply bandages, you don't always have to ask your friends for their arm or wherever to bandage them up. You actually have this mannequin that you can use. And we thought that might be kind of fun to try out sometime too.
All right. Well, thank you both so much. This has been very interesting. This project was funded in part by a generous grant from the National Endowment for the Humanities. As always, we are grateful for the generosity of our many donors. Thank you. To learn how you can contribute, please follow the link in the comments below or join us at colonialwilliamsburg.org. Janae, Robin, do you have any final remarks for us before we close out for the day?
We want to thank each of you for spending some of your time with us today. We hope you enjoyed the program, and we hope you'll come visit. Thank you.
Thank you.